Good morning, everyone. My name is Beverly Morgan, and I'm the Director of Sales and Marketing for Knollwood Life Plan Community. Today, I will be sharing with you some information in regards to giving you a better understanding of what long-term care insurance involves. But before I get to that, I want to share with you some information that's important to you about Knollwood in particular. Knollwood is a non-for-profit organization that has been in existence since 1962. Knollwood is a continuing care community that offers the following services. Knollwood has 160 independent living apartments. Knollwood has 45 assisted living apartments. Knollwood offers services to skilled nursing facility needs in 49 beds. Knollwood serves the members of the Knollwood community as well as the community at large for short-term care whenever needed. So just know that Knollwood is an organization that is here for you to serve your long-term care needs. So let's get into what long-term care insurance has to offer. Long-term care insurance is an insurance policy that will help you offset any of your extended long-term care needs. You may have the financial affordability to manage some things in regards to long-term care, such as if you need care at home, if you may need a care in an assisted living facility or in a skilled nursing facility. This is when and if you have an area of concern with providing your activities of daily living, and that is able to be accessed for someone who may have a chronic illness, disability, or is just aging in place. I want to give you a little information about the history of what long-term care insurance is and why it became a factor in the United States. As you know, the care costs for long-term care needs has spiraled over the years. But in the late 1970s to the early 1980s, individuals who were in need of long-term care services was realizing that the care was so expensive, even their assets and resources just wasn't enough. Luckily enough, some of the insurance providers enacted what they call a long-term care insurance policy that will offset any of your expenses when you have a long-term care need. How does long-term care insurance work? So what one would do is they would purchase a long-term care insurance policy from an insurance provider. In some cases, it would be when you're shopping for a life insurance policy. In some cases, it may be that it's an insurance policy that is offered by your employer. Either way, it's an insurance policy that you would have to pay for privately. There is usually an annual premium. Sometimes you can pay for the premium once a year or biannually. The insurance actually covers care services when and if you need long-term care. And again, that means that you need services in the following areas: in-home services, and as well as assisted living and in a skilled nursing facility. Typically, the long-term care insurance policy will kick in after one has paid privately for the particular services for a particular length of time. Let me give you an example. Let's say that you were at home and you have for the last month or two been providing or paying for a private duty care aid at a private pay rate. And then you were realizing, I have a long-term care insurance policy, and this probably could offset some of these expenses. At that time, you should contact your long-term care insurance provider and let them know that due to the fact that you now have a need for a private duty aid in your home, you will want to enact or execute your long-term care insurance policy at that time. Usually, depends on how you have purchased your policy. It could be a wait period of 60 to 90 days. So keep that in mind. It doesn't happen overnight, but once it kicks in, then you will start to receive the financial benefits of whichever policy you purchased and at what daily rate you purchased it. Understanding what long-term care is. Long-term care is not something that you should take very lightly. You should really take under consideration what you want your future to look like when making long-term care decisions. So long-term care will cover the following areas that you should take under consideration. Number one, your home. Is that an area that you want to liquidate and create some liquid assets so that it can help you offset some of your health and or financial needs? Or is your home an asset that you want to create a legacy with and pass it on to your children or your grandchildren, which means you probably would have to enact a trust. Then you want to also look into your health needs. You may be healthy now, but as we age in place, you will find that you will more than likely have a health condition that would warrant you taking under advisement, paying for, or getting involved or investing in a long-term care insurance policy. Then you want to also look at your overall finances. If you haven't actually created a situation where you have a financial advisor or a financial planner, that is absolutely something you should take under advisement. When you seek out a financial advisor, they can help you with all three of these areas of concern: how to maintain your assets on your home, how to look out for the best interest of your health, and then to help your finances grow. And making a long-term care plan about buying insurance and making a will, it's just not that simple. There's a lot of things you have to take under advisement. You have to map out how you want your future to be. What do you want that to look like? What is an independent life for yourself look like? What do you want to do? How do you want to live? What resources do you have to take under advisement in making your plan? Long-term care planning is considering what you'll need, when you'll need it, in order for you to maintain your independence, and your health is your wealth. So again, making medical and financial decisions is something you have to do in combination with one another. So having a financial advisor is something that I advise is a good thing to do, because they will help you try to figure out what your future looks like when it comes to your retirement. When taking these decisions seriously, one of the things that I will say is the small steps that you take right now will help you with living a happier and a healthier retirement life. How, when should you buy long-term care insurance? When will you need it? I would say you need it right away. Make decisions rather sooner than later. And the reason why I indicate that is because when you make the decision when you're healthier, number one, you can buy a better policy. The other is when you're younger and you make it, then the premiums that you pay are less expensive. So when do you need it? Sooner rather than later. Make an appointment with your advisor so that they can guide you along the way. What does it cover? When will you need it? When you see these small changes in life as we grow older, you'll see that, getting to your appointments or keeping up with your appointments may not be as easy as we thought. Cooking meals or making sure we can go to the grocery store to get the things that we need, that may become a little difficult as we grow older and or have problems with mobility. And then the act of activities of daily living, bathing, dressing, showering, things like that. And something as simple as medication management. It may not be that you can't manage as or take your medication, but can I open a pill bottle? Do I remember when I'm supposed to take it? And things of that nature. All of these things are covered under your long-term care insurance policy. According to AARP, they indicate that 28% of all adults over the age of 50 will at some point in time need long-term care. This is an important factor to keep under advisement. Most of us probably fit into that category. We want to make sure that we're living the most healthy, independent life as possible. So planning ahead is going to be a key factor in making sure that is something that you can do. AARP has done a survey that indicates 1 out of 5 of us at some point in time during the course of our life will need long-term care. So it's always better to be prepared and ready whenever it's needed. What does long-term care cost? According to the Gentworth survey that was taken in 2023, I want to share with you some of the monthly medium cost for long-term care services. To have a home health aide, it looks like that in 2023, the monthly cost would have been on average over $6,000. And that doesn't even include the costs and expenses for maintaining and sustaining your home. The other is in assisted livings across the country, the average monthly cost is about $5,000 a month to live in an assisted living facility. That is an area in which you can then enact to supplement some of those expenses if you have a long-term care insurance policy. Also for skilled nursing facility and or what's better known as nursing home care, on average for a private room across the country in 2023, that costs anywhere from $9,000 to $10,000 a month. Now, I want to share with you what that would look like in 2024 if you live in the Washington, D.C., Maryland, or Virginia area. The average median cost for care for a home health aide in 2024 is again a little over $6,000. For assisted living, of course, you see is much more expensive due to the geographic nature of the cost of living in the District of Columbia, Maryland, and Virginia. The assisted living cost is about $6,000, $6,000 to $7,000. And then for a private room in a nursing home or a skilled nursing facility, the average monthly cost is anywhere from $13,000 to $14,000 for nursing home care. So again, when should we get long-term care insurance? Now. Why should we get it? Because of these cost factors I've just stated here. Financial planning, I can't say enough about it. It's definitely fine. You know what they say, your health is your wealth. Financial planning gives you so many choices and options that's just unbelievable and amazing. And so we want to make sure that you have the choices that you prefer when you want to decide how you want to live your retirement life. So financial planning is aimed at the following: maximizing your finances and your wealth, minimizing or managing your risk factors. And number three, providing and protecting your future. When you have the resources, financial resources, you have options and choices that you can live with based on what you want your future to look like. The other thing with financial planning, not only does it help you determine what your retirement future is going to be like. If you're smart and you have a really good financial advisor, they're not only looking out for you, but they're looking out for future generations in your families. Financial advisors can help you with long-term care insurance and medical expenses. Absolutely, they factor all of those things into the plan. They also will help you determine based on what your needs are and how you've communicated to them, how you want to live or where you want to live. They will help you research and search out a great long-term care insurance provider that's going to help you have the life that you want to live in your retirement. What that does too is that help to complement the fact that you may have private resources, but of course, if you have a good long-term care insurance policy, that will also offset some of your medical care costs and needs. Advanced care planning, again, if you have a good financial advisor, they'll help you with this too. Why is this important? Is a key factor. Nobody can make better decisions about your life than you. You should have a voice, and you should make sure that your voice is always heard and your needs are always met. So having someone be your advanced care planning advisor or advocate is key. What that does is if and when you ever have a serious illness and you are unable to communicate your needs and your wishes, this individual will step in and be your advocate and your voice. That is when you have a medical power of attorney, and a medical power of attorney is a legal document that allows one to decide on what your medical wishes and desires are. And that is only based on what you have put in writing. A financial power of attorney is a legal document that gives authorization to someone to act on your behalf from a financial perspective. And then if you have a durable power of attorney, that's someone who not only is a legal document that can not only work on your behalf in regards to your medical care, but your financial care as well. It's either or and they can do both. It all depends on how the legal document reads. But it's important for you to have these decision-making factors in place when you're doing long-term care planning. When does long-term care insurance kick in? That's a great question. A great question. When 2 out of your 6 activities of daily living needs cannot be met. And so when we talk about that, I'm going to explain exactly what activities of daily living is so that you can know what areas of concern your long-term care insurance provider will be looking into. Ambulating. Are you able to walk, sit, stand, or lay down, or get up, climb stairs, or both, get in or out of your home? Those are things that are really crucial to make sure that they can make sure that you can function and have the mobility to be safe in your home environment. Grooming, whether it's personal hygiene, brushing your teeth, bathing, hair or nails, those are things that they take under advisement as well. Toileting or incontinence care, that's something that is a key factor that they consider as a need for activities of daily living. Dressing, being able to dress yourself. Can you actually button up or do those things on your own, or do you need someone to assist you with that? That makes a big difference on how you live your life. Eating is a key factor. Do you have the capability to still cook? Are you able to have the resources to have food brought in? All of those things are a concern. Or do you have some physiological changes that impacts the way that you eat? All of those things we have to take under advisement. And then cognition. As you know, in this country, there are millions of people that are suffering from Alzheimer's and dementia, and that also is a factor in regards to the activities of daily living to consider activating a long-term care insurance policy. So just know that typically when you start to see a decline or a change in 2 of those 6 activities of daily living, that's probably when you should probably look into calling your insurance, long-term care insurance provider and say, listen, I've had to call in a private duty aid because I need help with the following areas concerned: bathing, feeding, or eating. Those are the things that you should indicate. And you can say, I've been working on this now for the last 60 to 90 days, and I would like to put in a claim with my long-term care insurance. How can you help me? This is the time for us to put our long-term care insurance policy to work. Advanced care planning is key to living a successful retirement life, and a lifestyle, what I can say to you is that's one of the things that I love about living at, working at Knollwood is that we have the four different levels of care: independent living, assisted living, skilled nursing, and rehab. And then we also have memory care as well. But when you move into a continuing care community, all of your needs can be met. And that's something else. If you have a strong financial advisor, they can help you pick out a retirement lifestyle organization that can help meet all of your needs. Here at Knollwood, we are a five-star skilled nursing facility. We are award-winning and we provide excellent quality of care in our skilled nursing facility. Equally as so, we do the same in our assisted living facility. Quite often, people enter into our community in independent living, usually around 70, in their 70s or so. We find that when you move into a continuing care community early on in life, that you live longer because you have the capability of having healthcare professionals that would help put different modalities in place and help you monitor your health and your wellness. I want to share with you more about Knollwood. If by some chance you are looking to consider a continuing care community, feel free to contact us at 202-541-0149. Schedule a tour. You can come into our independent living apartments, our assisted living apartments, and we're welcome to share with you our skilled nursing facility services as well. I want to let you know the following things. Um, Two, I want to answer a couple of questions. Commonly, frequently asked questions in regards to long-term care insurance. One is, why is planning for long-term care using insurance worth it? Why is it worth it? Because when you have another option or financial resource, you do have more options to choose what care service you're going to get and when. Do I need long-term care insurance? I think if anybody that's over 50 or 60 years old is a good option to have because you never know when you're going to need it, but when you need it, you already have it. It's better to be ready so that when you need it, it's already in place. What kind of care does long-term care insurance cover? Again, long-term care insurance covers at-home care for private duty aides. It also covers assisted living care, and it also covers skilled nursing care. And that all is determined by the type of long-term care insurance policy that you have chosen to buy. When does long-term care insurance start to pay? Remember, I indicated that there was an eligibility time frame, and it's usually anywhere from 60 to 90 days from the time the services have begun. So when you find that there's been some changes in your activities of daily living, it's important for you to contact your long-term care insurance provider early on, make them aware of it so that you would know what is necessary to enact your long-term care insurance policy. It said, one of the questions is, will my health insurance cover long-term care insurance? And the answer is no. It's a separate policy that you usually have to buy from a private insurance provider. Thank you so much for joining me this afternoon. I hope I answered some of your burning questions in regards to long-term care insurance. If not, feel free to set up a one-on-one consultation with me. I will share with you as much information I have. And guess what? If I don't have it right now, I promise you I know somebody who does, and I will research that to make sure I can always answer all of your questions. So if you'd like to set up a tour or a one-on-one consultation, again, you can give me a call at Knollwood, and the number here is 202-541-0149. I also wanted to share with you that on April 16th, we will be hosting an Advanced Care Planning Day. That's National Advanced Care Planning Day, and we would love for you to come and join us. That symposium starts at 8 a.m. and will last till about 4 p.m. We have some dynamic national speakers that are coming to share with you their knowledge and experience in regards to advanced care planning. Thank you so much for joining me today. And again, if you want to have a one-on-one consultations, feel free to give me a call at 202-541-0149. Thank you so much and have a great day. Bye-bye.